Thank you very much. Can you all hear me? Great. On the slide there are some information, contact information in case you have some questions afterwards and you want to contact me for any reason. So on Facebook, on Twitter, also got email. Today's topic, we're going to be discussing the connection between cancer and diabetes, how to protect yourself from both. Diabetes and cancer are basically the two of the top three killers in Canada and the United States. Approximately 8% of the US population, or 25.8 million people, have diabetes. And it's projected that 1 in 3 people born in the United States in the year 2000 will get diabetes during their lifetime. 1 in 4 deaths in the United States is caused by cancer. The most common ones include prostate, lung, bronchial, colorectal for men, and for women, the most common ones include lung, breast, and colorectal cancer. The good news is that the number of people becoming long-term survivors is increasing, but the bad news is that a greater number of patients will have to face the challenge of living with both diabetes and cancer. There was a recent article in Medical News Today discussing the link between diabetes and cancer, and now they say that it's firmly established. So women with diabetes are 27% likelier to develop cancer compared with healthy women. And in men, it's 19% are more likely to develop cancer than healthy men. So basically, there are now a lot of good studies that show that diabetes raises a person's risk of developing cancer. Here's one of these studies. And it's argued that the mechanism by which this happens is that very high levels of blood sugar can damage DNA and thereby increasing the risk of cancer. Also, there's a connection between obesity, high insulin levels, high blood sugar levels. All of these can be damaging to the cells and precipitate cancer. One of the more interesting things that's been discovered in the past few years is that the drug metformin, which is used by a lot of diabetic patients, also is very effective at preventing cancers. So here you can see the link: obesity, lack of physical activity, high insulin levels, inflammation, and poor diet are all connected to both cancer and diabetes. And of course, obesity seems to be a very powerful link. And this is an article from Life Extension magazine. Can a diabetes drug prevent cancer death? And the answer seems to be yes. But interestingly enough, if you take a look at the natural health product berberine, some studies show it to be superior to metformin. In other words, berberine, which comes from golden seal, barberry, and Oregon grape, basically will improve insulin resistance and will reduce high blood sugar if it's high and reduce your risk of developing cancer as well as diabetes. Statin drugs, there are some research articles that say that drugs like Lipitor, Crestor, Zocor, and so on, these can increase the likelihood of developing diabetes by as much as 30%. According to WebMD, 50%. There's a high risk if you're using statin drugs that there's a 50% increase in risk for developing diabetes. Now, statin drugs are used basically to help lower cholesterol. And some people think that stress can also be linked to both conditions. Also, most recently, it's been found that Roundup, Roundup is a pesticide, and it contains something called glyphosate, and it's been shown to increase the risk of diabetes, autism, infertility, and cancer. So here are some of the risk factors that are involved in both cancer and diabetes. Of course, age, race, sex. Men have a slightly higher risk than women. Obesity, lack of physical activity. And of course, diet. Delayed food allergies. These can be associated with both blood sugar abnormalities, and that later can lead to cancer. Glyphosate, food additives, toxic heavy metals, alcohol, and smoking. All of these are risk factors for both diseases. High blood sugar or hyperglycemia causes increased risk for both infection, higher rates of cancer, recurrence, and mortality. And there's been a 50-year cover-up concerning the detrimental effects of sugar. And this is a paper that was never published and basically connects the use of sugar with both diabetes and cancer. And this is unfortunate because a lot of people, probably even in this room, love to eat things that are sweet. So how can you get yourself out of this vicious circle of, trying to avoid sugar and trying to stay healthy? Well, there are various things that you can take that will cut your craving for sugar. And they include the amino acid L-glutamine. L-glutamine, a dose of about 5,000 to 10,000 milligrams once or twice a day, will help curb your cravings for just about any kind of foods, particularly sugar. High protein and good fats, so if you eat a lot of those, that cuts your sugar cravings. Chromium picolinate, which is a mineral, somewhere between 1,000 and 5,000 micrograms a day. And certainly B-complex vitamins, especially vitamin B3 or niacinamide. Of course, exercise, and if you can avoid sugar substitutes, the reason being is that sugar substitutes make you crave more of the sweetness and will actually make your blood sugar problems worse. There have been a number of studies on artificially sweetened foods and beverages, and they were found to increase the incidence of diabetes, type 2 diabetes. So, which would you think is going to be worse in terms of prevention of diabetes, consuming real sugar sweetened beverages or artificially sweetened? And the answer is that artificially sweetened beverages tend to be more likely to produce type 2 diabetes than the actual sugar-containing ones. These are some alternatives that are reasonably safe, but once again, less is better. And they include coconut sugar, maple syrup, stevia, xylitol, and even honey. These do not have as much of an impact on your blood sugar as sugar or artificial sweeteners. And these are the worst sweeteners. They include aspartame, sucralose or Splenda, fructose, and agave, which is very high in fructose. Specifically, high fructose is linked to obesity, metabolic syndrome, insulin resistance, type 2 diabetes, fatty liver, hypertension or high blood pressure, hyperlipidemia, arthritis, and gout, as well as cancer. Now, the American College of Cardiology links 1 to 2 sugar-sweetened beverages a day up to a 26% increased risk of developing type 2 diabetes, a 35% greater risk of heart attack or fatal heart disease, and a 16% increased risk of stroke. So that's sweetened beverages. This slide says there's somebody in a crowd where they were offered both fish and bread, to be careful that it's gluten-free and that it's vegan and that it doesn't contain mercury. Unfortunately, a lot of our fish and seafood is contaminated with mercury and other toxic heavy metals. If you look at this slide, on the left you can see that primitive man only got about 1% of his calories from grains. And nowadays we get significantly more. 59% of our calories are coming from grains. And most of our other foods are coming from sugars and some vegetables and nuts, whereas primitive man got most of his calories from high protein, high fat foods. So you've probably all heard the paleo diet. The paleo diet is supposed to be very effective for controlling blood sugar, and there are several very good books on it. So the paleo diet is, I think, probably the best type of diet to follow to minimize your risk of developing diabetes. And it eliminates most of the grains, legumes, processed sugar, and most of the dairy products. The main foods that are permitted include meat and fish, hopefully organic, eggs, nuts and seeds, fruits and vegetables, except corn, and good healthy fats and minimally processed sweeteners, including raw honey, maple syrup, coconut sugar, and raw stevia. So that, in a nutshell, is a paleo diet. This was a scene at somebody's house on Halloween. So people are becoming more and more aware of what's in our food. And then there's, of course, the ketogenic diet, which is a little stricter than the paleo diet. It limits your carbohydrate intake to 5 to 10% of your calories. And it's very high in fat, 60 to 80%, and high in protein, 20 to 30%. So these are the best fats that you can consume, and they come from avocados, olives, coconuts, coconut oil. I know that recently there was somebody that, a scientist that claimed that coconut oil was dangerous and could increase your risk of heart disease. According to the studies, the exact opposite is true. Butter, also nut oils from almonds and walnuts. Raw dairy products may be a lot better than the regular kind, the unpasteurized kind, if you can get it. Raw nuts and seeds, eggs, grass-fed meats, and fish oil, but not the fish. The fish oil in Canada, if you're going to buy fish oil either as a liquid or as in capsule form, by law, the companies that sell it here in Canada have to have the mercury removed. But it's very hard, once you're caught the fish, to remove the mercury. These are the worst fats: palm oil, hydrogenated, partially hydrogenated fats. So those would be things like margarine, cottonseed oil, soybean oil, which is usually genetically modified and pro-inflammatory. What about wine? A little wine daily, Antonius, leads to longevity, perhaps as old as 35. So I think he was right, because recently there was a huge study that showed that not even one glass of wine a day is safe, that it will increase your risk of dying from multiple diseases, including cancer and heart disease. And what about glyphosate? American scientists who work for Monsanto and now Bayer have been saying that glyphosate is totally safe to drink and eat. Unfortunately, that is not the case. There have been recently various lawsuits against Monsanto that it is associated with a greater risk of cancer, heart disease, diabetes, and many other diseases, including, some people say, even autism. So Health Canada is now going to reevaluate the use of glyphosate in Canada as a weed killer. So this is a very recent study, October 22nd, which was run on close to 80,000 people, I believe. And it showed that you can reduce your risk of cancer by as much as 25% if you eat organic. So organic food may be more expensive, but so is cancer. Be honest, is this too much lettuce? This is not exactly the kind of food I'm recommending that people eat, but certainly you can eat the meat if it's organic, but not the bun. So this is the study I'm referring to. The diets of at least 68,946 French adults were evaluated over 4 to 5 years. And it was found that those that ate the most organic food had 25% less chance of developing many different kinds of cancer, including 73% less likely to develop non-Hodgkin's lymphoma and 21% less likely to develop breast cancer. So does the ketogenic diet fight cancer? Well, there are some good studies that say that it does. And these are the foods that you should eat more of, which would include leafy green vegetables, cauliflower, broccoli, seafood, not too much because of the mercury, organ meats. Organic meats are probably the best, eggs, seeds and nuts, berries, avocados, olives, and coconut, oil, lard, and ghee. The one good thing I could say about donuts is that donuts are healthier than crystal meth. Now, there are lots of studies now that show that the ketogenic diet is very effective in cancer therapy, not as a therapy by itself, but in conjunction with numerous other therapies. They are likely to make cancer therapy work a lot better. So the foods to avoid are going to be the processed foods, vegetable oils other than the ones that I told you about, diet soda, high-carb vegetables, sugary fruits, grains, and cut your carbohydrate intake down to as low as 5%. And I found, and so has the research, that a lot of people that suffer from different kinds of cancer, if you look at the green in this graph, all of the cancers are listed below there. You could see that this is effective for glioblastoma, which is one of the most deadly of the brain cancers, and many other cancers are benefited by ketogenic diets. And interestingly enough, many of the same foods that are recommended for curtailing cancer are also effective for controlling your blood sugar. And these include things like avocados, arugula, fatty fish, garlic and onions, sour cherries, apple cider vinegar, green leafy vegetables. He died of what? One day I had to be the bearer of bad news when I told a wife that her husband had died of a massive myocardial infarct. Not more than 5 minutes later, I heard her reporting to the rest of the family that he had died of a massive internal fart. You have to be careful with the terminology you're using. Anyway, this was sent to me by one of my ex-wives. No comment. More foods that control your blood sugar. They include various sprouts like broccoli sprouts, lentils, flax, and chia seeds. Those are great to add into smoothies, and they really also help improve your elimination. Cocoa, blueberries, blackberries, almonds, pistachios, other nuts. There are some studies now that show that pistachios tend to lower your blood sugar if it's too high. Eggs and coffee. There are numerous natural health products that lower your blood sugar. Most of you have heard of omega-3 fatty acids, black seed oil. I heard the last speaker was speaking about black seed oil, which is Nigella sativa. Berberine, I mentioned earlier, biotin, cinnamon, garlic, magnesium, chromium, all of those things tend to lower high blood sugar levels. As does zinc. Insulin, part of insulin is made up of zinc, so it's important to be adequately nourished there. Vanadium, which is a rare mineral, but it's been shown to both lower sugar as well as blood pressure. Alpha lipoic acid. That's a very important supplement, especially for diabetics that have what we call peripheral neuropathy, where you get numbness and tingling and you get pain in your feet or hands. Curcumin. Curcumin not only curtails cholesterol, but it also tends to lower your blood sugar if it's too high. Vitamin D. Definitely, there are all kinds of studies showing how vitamin D supplementation, 10,000 to 50,000 units a day, can lower your risk of diabetic complications. And there are certain herbs, fenugreek, gymnema, and white mulberry that can lower blood sugar. How many of you know that the highest concentration of omega-3 is found in snake oil. Apparently, snake oil is 28% omega-3. So I am today becoming a snake oil salesman. Of course, there are many antioxidants that will curtail diabetes and cancer, and they include any large class of substances that will neutralize free radicals. So they prevent aging, they protect your genes, and they're found in various plants. They're found in colorful fruits and vegetables, and they include things like lycopene, beta-carotene, vitamin A, flavonoids, vitamin C, E, selenium, and glutathione. Now, interestingly enough, when cancer cells are exposed to antioxidants, they increase the rate at which they are destroyed and become less able to switch on the gene that tells them to grow. So the most important of these antioxidants is glutathione. Glutathione is a tripeptide. It's made up of L-glutamine, L-cysteine, and L-glycine. It's thought that the reason why glyphosate does as much damage as it does is because it displaces L-glycine in various tissues and basically poisons our antioxidants. So glutathione is the most important antioxidant found in the body, and it has the strongest longevity side effect potential of any single natural health product. And of course, vitamin C, we all know of the many benefits of vitamin C for our immune system, cardiovascular, musculoskeletal, including our bones, gums, and teeth. And it helps fight infections. And Linus Pauling was the one that made vitamin C more famous. And he recommends between 2,000 and 4,000 milligrams daily, but as you grow older, you may need a lot more. The only side effect of vitamin C, if you take too much, of course, is diarrhea. So if you get that, that's your bowel tolerance limit. So then you have to cut back a little bit to where your bowels are moving much better. Vitamin C supplementation, this is a very recent study with as little as 500 milligrams of vitamin C taken twice a day. You can basically control blood pressure and type 2 diabetes better. So it can, in even that low a dose, lower high blood sugar and lower your blood pressure problems. And of course, Dr. Hugh Reardon and numerous other researchers have found that high-dose intravenous vitamin C can kill cancer stem cells, which is very interesting. So the doses used here are in the neighborhood of 50 to 75 grams. That's 75,000 milligrams given intravenously over a period of a couple of hours. And curcumin is an extract of turmeric. I think the last speaker was discussing turmeric. And basically, its major ingredient, curcumin, can do a lot of incredible things to reduce inflammation, to lower high blood sugar levels, and also fight cancer, lower high cholesterol readings, and do a lot more. If you go to Green Medicine Info, you will find an article about curcumin, how it can be effective in 800 different medical conditions. And of course, vitamin D. I wrote a book about vitamin D a few years ago, and vitamin D has both anti-cancer and anti-diabetes effects. It can also help with autoimmune disease, reduce inflammation. It'll help with diseases like multiple sclerosis, obviously also osteoporosis, and numerous other inflammatory conditions. And it's hard to get vitamin D from foods. As you can see, you can get it from fatty fish, you can get it from liver, you can get it from some meats as well, organic meats. But it's difficult for a lot of people to get throughout the year because most of us depend on sunshine for creating vitamin D under our skin during the summer months. And vitamin K2, it's another one of those vitamins that seems to make a big difference for numerous conditions associated with inflammation, including hardening of the arteries and cardiovascular disease, osteoporosis, of course, diabetes and cancer. And it is strongly anti-inflammatory in combination with vitamin D. In fact, if you're going to supplement with vitamin D, I would suggest taking it along with a little bit of vitamin K2, between 100 and 300 micrograms a day. There are numerous studies now on how curcumin improves type 2 diabetes. These are some of the mechanisms. It works primarily in the liver, and it seems to work on different enzymes. It's protective of numerous organs, including the pancreas, so it can improve pancreatic function. And the other benefit of curcumin is in obesity and weight loss. There are now some good studies to show that high-dose curcumin supplementation will help control both inflammation and obesity. Now, a lot of people think that taking vitamins in very high doses is dangerous or toxic. And I assure you that it is not. Dr. Abram Hoffer was the first person who was using orthomolecular doses of vitamins. So these are like very high doses of niacin, niacinamide, vitamin C, and B complex vitamins. And none of his patients ever died. Nowadays, you're going to see a lot more articles published in medical journals and picked up by the newspapers claiming that things like vitamin D are useless, that omega-3 doesn't help with anything. Much of this is orchestrated by the people at Big Pharma. So they are apparently losing some business. Not only are they losing business to the marijuana industry, in fact, in areas of the world where there's legal marijuana, that area of the world, the opiate deaths plummets. So the number of people that are using marijuana instead of opiates increases, and there are all kinds of studies that prove this. The same is true for nutritional supplements. There are a lot of people that are using nutritional supplements and avoiding major diseases, and Big Pharma does not like this. Aspirin is another one of these unfortunate recommendations, I would have to say, that there's absolutely no proof that there was a study that was done that showed that people who are older than 65 do not benefit from a daily aspirin supplement. In fact, what ends up happening is that they have a greater risk for certain diseases, including cancer. So I'm not recommending aspirin. The first 5 days after the weekend are the hardest, so just warning you. So that's basically all I wanted to discuss today. I'm sure there's a lot of questions, so if anybody wants to ask. Yes, ma'am. Supplementation with what? I'm sorry? Oh, curcumin. Yeah. You're talking about blood thinning? No, it's the only people that may have a problem with that are people that are on certain blood thinners. There's a lot of prescription blood thinners like warfarin or some of the newer ones. There could be a possible interaction there, but what I usually tell those people is start with low doses and work your way up. And if you notice any bruising or any problems with your circulation, then to cut back. But it is safe to use. It's not contraindicated. Pardon me? I haven't seen that. I've been prescribing curcumin for close to 40 years, and I've not seen any of that happen. Pardon me? You can cook with curcumin too, sure. Yeah. That's fine, yes. You can use it as, you can spray it onto your food, you can add it to smoothies, or salads or?
No, but I cook lentils and beans and
Yeah, that's fine. That works. Yes.
Can you recommend something? Certain foods cause some stomach acidity to line your stomach properly, and there's a lot of controversy about even probiotics.
Probiotics I haven't found cause too many problems. There are some people that get heartburn from probiotics. I usually tell them to switch to a different brand. There are certainly foods that will increase acidity in your system, and they include the grains, the dairy products, and high sugar containing foods. And of course, meats of all types and anything that's processed, all of those things will increase acidity. Yes?
You mentioned K2 and vitamin D are complementary. What are the natural sources of K2?
Natural sources of K2, well, your own bacteria in your gut manufacture K2. Also, most of our green leafy vegetables are a good source of K2. So if you're eating spinach or kale or broccoli, all of those are K2 sources. Yes?
Just a question. What is your opinion about the role of metformin for post-cancer patients?
There is evidence that metformin can reduce the spread of cancer. And in fact, there's one study that says by 60% even. So if you can tolerate it, then it's a legitimate treatment for cancer patients.
How many milligrams?
500 milligrams twice a day.
Just one more question. High dose vitamin C, you mentioned.
Yes.
Post-cancer patients, how often, like 60, 70, how often is optimal?
Normally twice a week, given 50 to 75 grams. Now, usually when people first start on IV vitamin C, we start at a lower dose. If they're very sensitive, we start even at 5 grams, and we work our way up. In order to get it, you have to get some lab work done, like the G6PD test, kidney function, etc. So if they qualify, then 50 to 75 grams twice a week. Yes? That's, yeah. Yes, they're now manufacturing liposomal vitamins, vitamin C. If it doesn't come from a soy source, then I don't have any objection to it, and it may be a good adjunct for people that are getting the intravenous vitamin C. I haven't had any experience with that one, but that probably would be very well absorbed. A precursor would be like N-acetylcysteine. Yes, you can do that. Usually, it's good to do both. I found that intravenous glutathione is more effective than the oral form. They're not as well absorbed. And in people that have gut issues, probably a precursor would be a better idea. Yeah. I'm sorry, I can't hear you.
What's the role of, or I would say, what's the impact of following paleo diet on LDL cholesterol?
Interestingly enough, it seems to bring it down. I've had a lot of people who are on the paleo diet, and if you check their cholesterol levels every 3 months, you'll find that it goes lower and lower. So this is a myth. It's kind of like, you know, if you're eating coconut oil, you're going to elevate your cholesterol. It doesn't happen. Yeah.
Do you, I know everybody's individual, but do you have like a certain kind of page of tests that you go through, like with people when they first come to you?
Yes. She was asking if I have a certain list of tests that I would do. It depends on the individual, of course, but for cancer patients, we do significantly more testing. Certainly blood and urine tests, and sometimes we look for toxic heavy metals. So we would look for, we would do that with a hair mineral analysis. And then we may do live cell microscopy as well in some cases. Yes.
Doctor, how much vitamin D should we take
To lower blood pressure, I think you need probably about a minimum of 10,000 international units a day. But you should get blood testing done before and after supplementing those kind of high levels. Yes? Vitamin K2 foods would be green vegetables, green leafy vegetables. And also if you consume probiotics, that's another, so foods like yogurt and kefir and pickles and sauerkraut, all of those will actually improve your flora so that they will make more vitamin K. Yes?
What are the potential benefits of taking fenugreek?
Fenugreek is used by a lot of women that want to improve their breast milk for breastfeeding. And it's also useful as a way of controlling your blood sugar. That's what I've been using it for over the years.
What would be useful alternative to Lipitor for reducing cholesterol?
The best alternative, I think, is curcumin. Yeah.
I had cardiovascular surgery, mitral repair, and one of my arteries is 30% narrow.
Hmm.
They gave me Lipitor, and my blood sugar went up.
Yes, well, they say between 30 and 50% of people taking Lipitor will have high blood sugar. Yeah.
First cardiologist said no. They did a glucose tolerance test and said the pancreas is okay, so it's got nothing to do with the Lipitor.
Well, I beg to differ. I mean, I've seen what you're describing, I've seen over and over again in my practice. Serrapeptase is an enzyme, and it's very good for breaking down clots and dead tissue in the arteries and that sort of thing. So that can be taken on an empty stomach a couple of times a day, and it does seem to reduce plaque in the arteries. And yes.
Vitamin D level is over 250.
Mm-hmm.
So can you tell us side effects?
Well, the only side effect of too much vitamin D is high calcium levels. If you get high calcium levels, you're taking too much D. Now, some laboratories say the upper limit is not 250, but 600. So if you look at some of the downtown laboratories, like at Mount Sinai Hospital, their toxic level is 600 or greater. So really the only issue is too high a calcium level that can deposit in your arteries, kidneys, or joints. Yes, sir. Yes, nattokinase is a fermented product which is very effective at thinning the blood. And I think it's going to become legal in Canada relatively soon. There's all kinds of applications for it. Nattokinase is also very good for getting rid of chronic nasal and sinus congestion. And it's even been used for helping people who have nasal polyps to shrink them.
You can't get it anywhere here in Canada.
Pardon me?
Nattokinase, you are not getting it here.
Well, you can order it in from the United States. You can go to various websites that sell nattokinase. There's many of them. Like, for example, Life Extension Foundation, and even Amazon.com is selling nattokinase, so you can get it for personal use. It's perfectly legal.
Paid too much customs, it's terrible.
Well, yeah, that's true. But hopefully in the next year or two, nattokinase will become available in Canada. Nattokinase, nattokinase. Yes. No, as long as you order it in for personal use, it's legal in Canada. Yes, that's right. Yes.
You mentioned
That's a good question. There are some people that may develop some liver irritation from taking berberine for too long. So, probably don't use it for longer than 6 months. Yes. Probably 1,000 milligrams a day would be a good preventive. But one reminder, you should probably use it with food. If you take it with food, it doesn't irritate the GI lining. Yes. My opinion of naltrexone, low-dose naltrexone has been shown to help fight autoimmune disease, including conditions like fibromyalgia, chronic fatigue syndrome, as well as various cancers. It seems to have an inhibitory effect on cancer spread. Some people, they get weird dreams with it because it's recommended to take at night, and it may produce very vivid dreams and scare people. But that's about the only side effect I've ever seen. Yes? Anything you can take to keep your hair from getting brittle? Well, essential fatty acids are important. Black seed oil, omega-3 is very important. And check your thyroid, because low thyroid or an underactive thyroid can produce changes in your hair, yeah. Yes?
I had hepatitis C from a blood transfusion years ago.
Yes?
Went through treatment 4 years ago. Went from F4 to F1 in terms of the fibrosis, damage of the liver. Is there any way to reverse cirrhosis? I still have some cirrhosis.
Well, there's quite a few things that you can do. Like many of the herbs like curcumin are effective, and you've probably heard of milk thistle. Black seed oil is another one that seems to be effective.
What do you think of a herb called
Gugu lipids, it's often recommended to lower cholesterol.
Yeah, is it good?
It seems to help some people.
Oh, really?
Yeah. You can try it and see if it makes a difference for you, It doesn't help everybody, but
Yeah, does your company Star Natural, they make,
no, they don't make it yet. We're working on a formula. Yes.
we have low platelets from Wikipedia, but other tests are not showing anything. Low platelets.
Low platelets.
Over 100, let's say, but don't have
So your question is what to do about it, you mean? Well, I think that's an ideal case for intravenous vitamin C, a very high dose of vitamin C. Yeah. Yes. To treat Parkinson's disease? Well, Dr. David Perlmutter in Florida, who's a neurologist, has written a lot of papers on the use of intravenous glutathione to reverse Parkinson's symptoms. So that's a lot different than taking it orally. Orally, a person probably would be better off using N-acetylcysteine in very high doses, like about 3,000 milligrams, along with vitamin C, but the glutathione should be given intravenously. Yes?
Could you speak about the need for being careful of what source of our supplements are, for example, vitamin C?
The source of vitamin C, for example, there's really only one or two different sources, and all the different companies basically draw from there and make capsules out of it or powders. For some things like the herbal remedies, probably the best would be as organic as possible. There are lots of companies that make excellent herbal products. For vitamins, I don't think it makes much of a difference. For minerals, probably not as well, but for herbs and other natural health products, it makes a big difference. Yes?
Dr. Rona, there's so many things to remember to digest. What, in your opinion, is one of the best grain foods
One of the best brain foods? Well, probably walnuts. Walnuts look like the brain. Lithium is a mineral which improves brain function and memory. Something called magnesium L-threonate, which is a combination of magnesium with L-threonine. It improves memory. There are all kinds of herbal formulas as well. Vinpocetine is another extract of a herb. 10 milligrams once or twice a day is effective for improving memory. Of course, omega-3 is very important. 70% of your brain is made up of fat, so consuming more fat is effective, especially the healthy fats I talked about earlier.
Somebody said krill oil is the best.
Krill oil is a source of omega-3. One of the benefits of that one is that it doesn't produce as much backlash, like that fishy odor or that burp. People tell me that they burp up omega-3 and they smell like fish. Well, krill oil, you don't get that. The drawback to krill oil is that it's a relatively low potency omega-3. That's the only drawback. Yes?
Speaking of magnesium L-threonate, is there any hope that it might come down in price? Somebody was describing that they went through all these tests in the States, so that's why part of the reason why it's so expensive. It's more expensive than other magnesiums.
Yeah. I think with pretty much all products, when they first come out, they're more expensive, and then as the years go by, they become less and less. Yes?
When a patient comes to you, presents himself with cancer, is protocol normally, or what do you do? Do you go parallel natural health as well as the conventional, or do you go natural for whatever 6 months until that doesn't work and then go conventional?
No. I tend to follow basically what the patient is already doing. Usually it's conventional treatments, and then we use complementary treatments at the same time. So as far as all the science says, if you use both, you get better results. So we tend to use the complementary treatments alongside the conventional ones. That's what I usually recommend patients do. Yes, sir.
Hi. If you've done nothing so far with cancer, no conventional treatments, should you explore them before you start natural?
Well, it's important to get a diagnosis and to know what your options are. So, the best thing to do is to see a specialist, get an opinion, and then if you feel that it's making a lot of sense, then go ahead and do that kind of therapy. And later on, certainly it would be good to do both the conventional as well as the natural treatment at the same time.
So do both.
Yeah, I would do both. Yes, sir.
Do you recommend
Bioidentical hormones? Depends on the case. Usually if people want to use it for anti-aging purposes or for improving menopausal symptoms, it's a valid therapy. There's been a great deal of interest in it over the years, and I think it's very effective in most cases. Well, certainly low testosterone. Yeah, I believe in testosterone replacement therapy, for example, yeah. Yes? Yes, all of those have had some research behind them. They're not in very broad scale use yet, but eventually they'll become more and more interesting for people who have cancer. I'm not sure. I don't know very much about that particular one. Yes, sir.
Another question. Mistletoe treatment.
I don't personally use that treatment, but I know naturopaths have used it in treating breast cancer. It seems to help some people with, disseminated breast cancer. But
So it's just basically breast cancer.
that's the one where I'm familiar with its use. Yes.
Something about the lighting, especially upstairs, not here so much. I find when I go into places where there is, say, neon lights or whatever, like upstairs, it really bothers me. Is there anything that your body is missing that is affected by?
That's a very good question. Years ago, I had a patient who had that same problem, and we had her take high doses of beta carotene, and that seemed to make a big difference. So you may want to look into that. Beta carotene, lycopene, lutein, all of those things will help improve eye sensitivity.
I read in your book, about diabetics, they might have even candida infection.
Well, yes, one of the problems with diabetes is that because of the high blood sugar levels, it encourages the growth of fungi in the system. So candida is much more common.
Yeah, that's what I read in your book.
Yeah.
How long is the waiting just to see?
2 to 3 weeks usually. Yes, Yvette. Dry eyes, that's a good question. That can often be helped by transdermal testosterone. It can also be helped by the essential fatty acids like omega-3, and then of course by a lot of eye enhancing supplements, things like lutein, lycopene. Pardon me? Well, in cases where it doesn't work, transdermal testosterone seems to work, and I don't know why that is, but it does. Women need testosterone too. Yes, a bioidentical hormone, yes. Well, if you're using testosterone, you may not be using enough. You have to up the dose, basically. Yes?
You mentioned coffee is beneficial for some of them. It's acidic, right? So how many coffees per day?
Well,
The red wine question.
the red wine question, well, it's kind of hard to go against that kind of study, but I think if you had 1 glass of red wine every 2 to 3 days, probably it's going to be okay. I mean, there are antioxidants in red wine, as there are in coffee, But I would avoid the heavily sweetened and flavored coffees like you get at certain chains, Like an 800 calorie something frappuccino is not one. Regular black coffee. Yeah. Yeah, 1 or 2 is not going to kill you. There's good evidence that controls your blood sugar. Yes. Right. Well, that could be due to so many different things. You have to consider things like allergies, for example, nutrient deficiencies, especially in zinc, vitamin A, beta carotene. Associating with cancer? I've not seen that. Breathing in chemicals? Oh. I'm not sure what that could be from. Could be an infection, could be some kind of allergic reaction. Yes? It's better absorbed than oral glutathione. There's a brand called Cetria glutathione, which has a pretty high absorption rate, something like 70%. Yes?
What can cause a mini stroke in the retina?
A mini stroke in the retina? Well, that can sometimes be related to cardiovascular problems, either some kind of blockage, or it could be due to diabetic retinopathy. So it could be a complication of diabetes as well. Yeah.
And the high doses of vitamin C have an impact on the kidneys, especially if you're diabetic.
Can high-dose vitamin C be effect on the kidneys? Years ago, there was a myth that vitamin C caused kidney stones, and that's been refuted over the years. If you have kidney disease, you have to be careful using high doses of vitamin C for other reasons, usually because of the acidity. But other than that, there aren't any major problems. Yes?
As a substitute for sugar, do you like
Xylitol? Yes, that doesn't.
hardwoods?
Yes, that doesn't raise your blood sugar level. So honey probably is effective as well. There's some studies that show that it actually improves your blood sugar levels. Stevia is another one of those that's acceptable. That's okay for diabetics. Yes?
I know Charlotte Gershon has said that chemotherapy can destroy the effects of any natural supplements or Gershon diet.
Chemotherapy can kill cancer cells as well as your own cells. And when you use natural therapies in conjunction with it, shortly afterwards, the repair and the benefits of the natural therapies can still be found. So I don't 100% agree with that statement. Yes?
Do you have a protocol for weight loss?
Protocol for weight loss? I treat everybody a little bit differently. I don't have like a diet plan that suits everybody. So there are some people that do much better with a vegan diet as opposed to a diet which is more paleo and with animal proteins and so on. So everybody's a little bit different. I don't have a protocol that suits everybody. Yes? Xylitol is not corn derived. No. It's from, I forget the name of the hardwood that it comes from, but it's from beechwood? Thank you. I think that's correct. Yes? Oh, B17 Laetrile. Well, the issue there is cyanide, which comes from B17. I've not seen too many good results in people that went to Mexico who got that kind of treatment. I've not seen any spectacular results, and I worry about, the cyanide. Anybody else? Snake oil? Well, snake oil contains the highest concentration of omega-3 of all animal species.
Are they gonna start manufacturing that?
No, that was meant more as a joke than. Yes. Yeah. Intermittent fasting, yes, has become popularized in the past few years. Seems to be very effective for many people who have weight control problems, who don't do well on low-calorie diets, whose thyroid is also normal, and basically they have tried everything. Intermittent fasting seems to be effective for a lot of those people. There's a website called Mercola.com, and Dr. Mercola has dozens of articles on it. Yes?
Apricot kernels.
Yes. I don't recommend them, because of the cyanide, I don't want to poison any of my patients. So, cyanide in apricot kernels. Yeah. Yes.
Organic apricots have cyanide in them?
Not the apricots themselves, but the apricot kernels, the seeds. So I don't know too many people who eat those things. Yes. Of which? I'm sorry. Oh, melatonin. How many milligrams? Usually 3 milligrams. But for cancer patients, 20 milligrams or more. Well, there have been studies that show 100 milligrams is safe. 20 milligrams, I think, is the right dose for cancer. Yes.
Are you a big fan of saunas?
I'm a big fan of saunas. Yes, I am. They detoxify better than anything else that I know of. Yes.
What's your opinion of the biomass?
The biomath? I'm sorry, I don't know what that is.
Well, it's a biomass, it's an ion with direct, it's a direct current, and it's supposed to be like infrared sauna.
Well, if it makes you sweat, it's a good thing. It means that you're detoxifying. Sweating in a far infrared sauna is considered safer than a regular sauna. So people with cardiovascular problems can use the far infrared sauna, but the regular sauna may be a problem for people with kidney disorders or cardiovascular problems. Yes, sir.
How about PEMF?
PEMF.
Pulsating electromagnetic frequency.
You got me on that one. I don't know. I'm sorry. Yes.
What would you recommend for the dosing of regular diabetic medications with cinnamon?
With cinnamon, 500 to 1,000 milligrams with each meal. So they usually come in 500 milligram capsules. I think Sisu makes it, although there may be other companies as well. Yeah.
Do you like the magnetic mats?
The magnetic mats, I think they work for some people. They're pretty effective. Some people with arthritis, osteoarthritis seems to help.
What about
Earthing. Yeah, I know about that too. That probably would help a lot of people as well. There's some good articles, once again, on Mercola.com if you want to look it up. Okay, well, nobody's telling me to get off the stage, but I've come to the end of my time, yes. Best cooking oil? To avoid, I think coconut oil is probably the best. And I would avoid corn oil and any vegetable oils. Those are not healthy. Yeah, coconut oil and olive oil would be good. Also peanut oil if you're not allergic to peanuts, because it survives high temperatures.
Avocado?
And avocado as well, yeah.
Does a good vitamin one a day give you enough minerals for most people?
It's a good preventive, but it may not be effective for a lot of people, so. But it's better than nothing.
I've been using grapeseed oil for the last 15 years. Is that
Grapeseed?
oil?
Yeah. Yeah, that's pretty healthy, but I'm not sure whether or not it survives deep frying or high temperature cooking. Then that's fine. Sure, that's okay. But if you want to boil it or fry foods, then it won't work. Coconut oil would survive a lot better. Yes? You can't use flaxseed for cooking. It quickly gets oxidized. Huh? Well, if you want to believe that, I've got some lakefront property for you in Saskatchewan. Thank you very much for